Honourable Leader of the New Democratic Party.
Mr. Speaker, I would like to ask the Premier about vulnerabilities in our healthcare system in light of the growing likelihood that COVID-19 will spread to Nova Scotia. Reliable access to emergency rooms will be vitally important if Nova Scotia experiences an outbreak of COVID-19. However, last year, unscheduled ER closures more than doubled. In Cape Breton, we have emergency rooms that are only open around a third of the time. Mr. Speaker, where will patients facing COVID-19 go for necessary treatment and testing with so many of our emergency rooms closed so much of the time?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. Speaking with Dr. Strang today, he's been working with his partners across the country and the national government to ensure that we continue to provide standards from province to province to ensure that we deal with this potential outbreak. We have, as a province, testing that takes place inside of our province, where currently there has been ongoing testing for people who show up with the flu symptoms, Mr. Speaker. Fortunately, there's been no positive tests. And if there is one, Mr. Speaker, that test would then be sent to Winnipeg to be confirmed for a second time. But there's been ongoing public announcements. One of the things Mr. Strang was very clear about, people need to continue to do the normal general hygiene, making sure you continue to wash your hands, keep your hands away from your face, Mr. Speaker. And if anyone feels those symptoms, they need to go and first of all self-identify, and then we can provide that test.
The Honourable Leader of the New Democratic Party.
What I'm asking about, Mr. Speaker, is the question of the readiness of our healthcare system. Nursing home employees have been reporting for some time that the funding cuts of 2015 and 2016 had real negative, significant implications for hygiene and cleaning operations, and these are very important when it comes to the spread of infection. In light of heightened concern for protecting this vulnerable population from the spread of infection, will the Premier restore the funding that his government took away over those 2 years from the nursing homes in Nova Scotia?
The Honourable Premier.
Thank you, Mr. Speaker. We continue to increase the healthcare budget across the province. Mr. Speaker, every budget we've introduced had an increase in healthcare funding. The honourable member will know we continue to make strategic investments working with our partners. And as I said before, Dr. Strang and his team are working very hard to ensure that we continue to monitor and control if this infection arrives in our province.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, we have hospitals with entire floors of patients who are only there because they're waiting for a place in a nursing home. The fact that the government has still not opened up a single new nursing home means that there continue to be shortages of available active hospital beds all across the province. In this situation, how can the Premier be confident that our hospitals will actually have the capacity to receive expanded numbers of infected patients?
The Honourable Premier.
Well, Mr. Speaker, the fact of the matter is we're building 60 new beds into Waterford. I hope the honourable member doesn't vote against that. We're building 60 new beds in the north side, Mr. Speaker. I hope the honourable member doesn't vote against that. We've announced building long-term care beds in Eskasoni. We've introduced 30 new beds here, Mr. Speaker. There's a redevelopment taking place in Clare. I believe there's some additional beds associated with that, as well as in Mahone Bay. Mr. Speaker, there are additional beds associated with that redevelopment that's happening there, Mr. Speaker. We're continuing to make those investments across the province, and we want to thank all those healthcare workers who continue to work with us, and quite frankly, the private sector who have also been working with us to help provide the care that Nova Scotians require.